All right, it gives me great pleasure to introduce Ms. Kay Matthews. She is the founder of the Shades of Blue project and the executive director, and that works to break cultural barriers in maternal mental health. Go for it, Ms. Matthews. Thank you for joining us.
Thank you, Melissa. I appreciate the invite. Again, Kay Matthews, executive director of the Shades of Blue project, where we focus primarily on Black maternal mental health. So what I'm going to present on today is what we call the I.N.S.P.I.R.E method. It is our community-based organization approach to shifting the culture when it comes to maternal mental health, therefore improving maternal mental outcomes for women of color and the women in populations that we serve. Next slide. So some of the topics that we will discuss today is how to identify unique stressors in women of color who are dealing with maternal mental health complications, prioritizing maternal mental health in our communities, and what you can do to change the current outlook of maternal mental health for women of color, and implementing the I.N.S.P.I.R.E method into your everyday practices. Next slide. So as you've heard from my colleagues before me, we know the numbers, we know the statistics. And here you see 1 in 7 currently have a lack of support focused specifically on addressing PPD complications in women of color. Current statistics show that 1 out of 7 white women experience PPD. Next slide. While women of color are 1 out of 4 times likely to experience PPD, yet their symptoms will often go undiagnosed. So now I want you to ask yourself, like, how do we get here? Like, why do we have such large gaps in our statistics from one population to the next? Next slide. It's about numbers, right? We see the statistics, but what I often feel like that's missing from the statistics is the voices of the statistics. The statistics come from real people. And so next slide. Here's what our clientele tells us. We initially ask anyone who comes into our office for service, what is stopping you from getting any type of mental health care? What are the barriers that exist? Because what I truly believe in is that it is the community voice that should always be the framework of this work. And so here are the top barriers that women have told us that they experience in the postpartum period. So I'll give a few seconds just for you to overlook. And what you'll notice is some of these are in bold, meaning these are the things that we continuously hear over time, like constantly. My mental health is not that important. I've heard maternal mental health or mental health services referred to as a luxury. It's not something that you really focus on. You know, if you have the ability to pay for counseling, go to sessions, then that's great, but it's not at the very top list as a priority. One, my doctor doesn't listen to me. That's really actually number one. It's like, why would I bring up that I'm struggling mentally when they're not listening to me about other things? Certainly would not be listening to me about how I feel, because also not listening to me about other things, that's mentally challenging within itself. What will my family say? We all know about the stigma that is associated with mental health as a whole, let alone when you have a child and what happens in that postpartum period. The last time I asked for help, I thought they would take my baby away from me. That is a constant fear of women. Actually, that's a constant fear of women all the way across the board. When you have a population of women where that stigma is already placed on them before they even open their mouths, they feel that way, that's a problem. And so again, these ones that are in real bold, those are the ones that lead us to continue to work in a way that serves the women, one, not just the way we want them to be served, but how they want to be served, in what way do they need to be served, so that we really take a different approach to changing, breaking stigma, breaking habits that providers are used to, how they treat a patient, just full circle a lot of the experiences that women are having. So our approach and our direct services come from that mindset. Next slide. So when creating the I.N.S.P.I.R.E method, we definitely understood that traditional approaches to addressing PPD among women of color have proven to be lacking given the disparities. This method presents a non-traditional approach, and we call it a non-traditional approach because it's coming from the community. This non-traditional approach to combating and reducing statistics around PPD, specifically in women of color. Next slide. And so what we did over a 6-month period, we had 3 groups simultaneously running that were actually using our journaling method. We have a physical journal that they can write in, full circle outlines, everything that they need. Then we also had 3 groups that were journal users. So 3 groups without the journals and 3 groups that did not. Next slide. And so here is the I.N.S.P.I.R.E method as we implement it today. It's an acronym. I.N.S.P.I.R.E is an acronym. It's that what can I do on a daily basis to, 1, take control of what is happening. You've heard my colleagues before, and you continue to hear in this space around us having to advocate for ourselves. It's so much more to it when you're thinking about mental health. I literally have to advocate for myself, maybe to get out the bed. Advocate for myself to take care of my child, whatever manner that is. Advocate for myself to go to work, do the daily things that I need to do. So this thought process came into play is, what's one word I can do on a daily basis that can propel me or push me towards my end game, which is to get into this recovery state of mind. And so here's that method. 1, you have to initiate change. Oftentimes you hear someone says, well, things need to change or you need to change. 1, if you don't know what to change, you don't know how to get started, right? So in order to initiate the change, when you figure out what needs to be changed, then that process starts. But someone has to actually literally talk you through that process. It's not something that we automatically know. Nourishment and exercise, that fits into people's lives however it fits. Every individual is not the same. We know we need to eat, and yes, we know we need to eat the right things, but you also have to take into a lot of other factors and what that means. So we don't ever want to shame anyone on the choices that they make, but we do want to give them the resources to make different choices in this process. So this nourishment and exercise is really just guidance. This whole method is guidance. We want structure, right? We need structure, but we don't want to be told what to do. So this structure is really just like an outline for you to follow and to adapt it to your everyday life, because again, we are all not the same. The spirituality and prayer, you cannot overlook religion, especially when religion within the Black community plays a prominent role. Prayer comes into place. It's the thing we look for to heal in certain ways. But if we leave that out of the conversation of mental health, we lose a lot of people. So we make sure to put it into this process. Patience. Unfortunately, we are not born with it. It is something that we learn over time. So this patience is something that we teach, and that there's no actual time frame on learning patience. We certainly wish it would come just like that, but it doesn't. So we take a look at what that looks like. Involve others. The hardest thing to do when you are experiencing something mentally challenging is to ask for help, get one to help you, because oftentimes when we need help, we don't know the right words to say. We don't really know, like, how am I supposed to say this? How am I actually going to get what I need? And so it's very difficult to involve others in this process, but it's a step that can't be missed. So we talk through like what that looks like, what that feels like is really the main part of that, because again, mental health is tied to your feelings. If we are dismissive of the feelings and how we're feeling, then we're missing the mark. So that's what the involve others is. It's really showing you how to ask people for help, the help that you need, so you don't have to suffer in silence. Rest and relaxation, we don't get enough rest. Certainly don't know how to relax. What that looks like and what that feels like is techniques that we teach. Something as simple as writing 10, 20, and 30 minutes on a piece of paper. And when you need to take that break, put it somewhere where it's visible. you have to, what we want our clients and patients to understand is sometimes you really have to demand respect. And when it comes to rest and relaxation, one goes that when you're a mother, a father, or the leader of the household, you're constantly on it, on it, on it. But you cannot be completely in it if you're not getting enough rest and relaxation. So that respect of time comes into play. Using those little papers that when you see this green paper and it says 15 minutes, that means I need 15 minutes to myself uninterrupted. And what that looks like and what that feels like, both for the person that is doing it and the person that is receiving it. And so in mental health, there's a lot of, especially for moms after giving birth, there's this experience of blame sometimes. Like, why am I feeling this way? Why are things this way? You like, what is happening? This must be my fault. All of these different intrusive thoughts come into play. This last piece of each day is a new day to start again is to remove the blame. It is to make you feel better about if I make it to the next day, I get to inspire myself all over again. It doesn't matter if I did everything in the Inspire method, but I do get to start all over again. So each day is a new day to start again. So it removes that, hey, I failed today. I ate a hamburger, or I didn't eat that salad, or, maybe I didn't eat it all that day, my one meal versus 3 meals. All of those things, all of the things that come into play. Maybe I missed a recital at my child's school, or I left the diapers out of the bag. All the things that go through our mind as parents, this ends that. This lets you start over the new day, all new, starting from the top and just working through it. Because what we have found and what we know to be true is getting folks in a recovery state of mind allows them to understand that it could be, you could go 2-3 years without any incidences or occurrences. And then bam, you have this bad day and you feel like, oh, I messed up. Like I can't move forward. This is not working. This method allows you to understand that you're taking literally these steps one day at a time. There's no right, wrong, any of that. This is a process, and it is a day-to-day process. And this is what this method encompasses. Shifting the mindset from all of the things that we have heard or the things that we've heard over the years about take your time or time moves quicker than you, all of those different cliches that we've heard. This is really breaking and dismantling that so we get, again, a recovery state of mind. Next slide. And so what we learned from these 6 groups total is the participants were screened before and after the 6-week session. So each group went into a 6-week session, basically taking the Inspire method and working on each section each week. We used the PHQ-9 scale. We also use a culturally specific norm stress scale created by research psychologist Dr. Fleda M Jackson. Research of the program included self-reports and screening results, which indicated that participants were able to increase coping skills and distress tolerance. Participants also expressed increased willingness to engage in maternal mental health counseling and decrease the stigma against seeking treatment. Next slide. And so what are the, full circle, what are the 3 components to a successful implementation of what we call the Inspire method? One is the acknowledgement. So often women feel not seen, not heard, a group of other things that are happening mentally. We all want to be seen. We all want to be heard. And one of the ways we do that is acknowledgement. It's simply, I see you. That's why the little eyes there, like, I see you. Like, you're not invisible. You're not just another number. Respect. We all want to be respected. I feel like it's mandatory. It's not something that you leave out. It's like, well, it depends on how that person treats me. If we are giving respect, surely often we will get it back. And even when we don't get it back and we acknowledge to that person that, hey, I'm in a respectful tone, I'm in a respectful place, let's communicate with each other. Like, this is the shared decision making that some of us have talked about thus far. Respect is huge. Supporting one how they want it and how they need it, not just how we want to give it to them. And how you get to that point is you actually have conversation with folks. This is a social support design service that is being offered, and how you offer support to someone is the way that they want to receive it, and that's how you get better results. So acknowledgement, respect, and support, those things are mandatory, not optional. This should be given to every client and every patient that you encounter. Next step. And so here are a few, again, of the ways we're breaking the maternal mental health depression cycle. That increased coping skills and distress tolerance, meaning learning to deal with issues effectively on a daily basis. It's imperative to say on a daily basis, so one doesn't feel like if they went 2 or 3 weeks and everything was all good, that they slipped and something happened and it sets them back. Actually teaching them how to move forward. Like, it's going to happen, but how do you handle that situation and move forward? The willingness to seek counseling services was huge for us because there's such a stigma around mental health and seeking treatment and even just talking about it. So understanding how effective counseling services can be during maternal mental health complication is imperative. Like, if we understand like this is going to help and not hurt, then this is how we got the results of those willing to seek outside of the support group actually start to talk to a therapist or a counselor and get the additional support and help that was needed. The decreased stigma associated with maternal mental health, meaning making the postpartum period, the 4th trimester, making that a norm. It's like you have this baby, now you're going into this next phase of delivery. So understanding that stigma is a barrier that comes from lack of understanding and has no bearings on who you are or who you hope to be working towards by seeking treatment. So normalizing getting the help that you need in that 4th trimester. Next up. In conclusion, we consider this to be a therapeutic model used by this program, proven to be both helpful to those participating and in reducing statistics around postpartum depression in women of color. It has also been proven to be a cost-effective approach to addressing this issue, as Dr. Tab discussed earlier about the cost of postpartum depression and the treatment and all of these other different things. So we look at this as a therapeutic model that is very low cost and very effective. Next slide. So what are our next steps at the Shades of Blue Project? Next slide. A few things, a continued plan for 2021. We all know how devastating the COVID era was and continues to be. But in the midst of that, we must move forward and continue to serve our community through outreach, making those daily adjustments to be able to serve people where they are and how they want to be served, and also how they need to be served. Of course, we are in July next month, we're opening up our Black Maternal Mental Health Resource Center and Community Clinic. We are continuing to offer our I.N.S.P.I.R.E method training, and then our Black Maternal Mental Health Week, which is July 19th through the 25th. Next slide. But what I will close with is, this is a collective effort. What you have seen today with my colleagues that have come before me, and what you will continue to see in this maternal mental health space, is this is a collective effort. We have to do this together. So long that mental health has been pushed to the wayside or pushed to the back, we have to push this thing forward. The only way we can do this is a collective effort. So I appreciate being able to present today and this opportunity to show you the action steps that the community is taking. Thank you.